I think the hardest process for me was just feeling like crap. My son said that I looked scary with no hair. I think that, I tried really hard for it not to affect the everyday for them. I like to wake my kids up in the morning. I like to rub their back and see the smile on their face when they look at me waking up. It's just that innocent look from your kid's face looking at you. I felt the lump. I went to the doctor. I had the mammogram, then the ultrasound. Then I went and had the biopsy. And then on Monday, while we were in the airport to come back to Ohio, I got a call from the place where I had the biopsy, and they said, "We need to make an appointment for you to come in for your results tomorrow." I was 38 years old when I was diagnosed, and I was diagnosed with breast cancer, stage 2B, triple negative. I'm sitting there listening to all this information, and I couldn't even concentrate on the information because all the thoughts that were going through my mind is, well, what do I need to do? How am I going to get through this with my kids, my husband? All of these things, so much is going to change. A mom/friend and her kids were very helpful to me. And her name is Jane, and she told me about this organization called Pink Ribbon Girls. Jane said at the time at the hospital, she looked at me and said, "Please let Pink Ribbon Girls help you. You don't need to do this on your own." And they began providing us meals for the family, which the fact that it was these individual meals for each person in the family, and we weren't going to be food wasteful, and it was healthy, balanced meals, was amazing to have that help. Because even though I was home, I wasn't feeling well, so I didn't feel like preparing dinner. PRG has become family to me. And for someone else to be able to have that in their life, I can't imagine them turning that down.
I'm Dr. Heather Pulaski, and I'm a gynecologic oncologist, which means we treat all of the women's reproductive cancers that are not the breast. We were thrilled when the folks from Pink Ribbon Girls, or PRG as we call it in our office, came to us and said that they'd like to offer their services to our women as well. Because a cancer diagnosis is so overwhelming, patients just don't even know what they might need. And the nice thing that we can do when talking to them about Pink Ribbon Girls is give a good list of the services that they offer. And that really points to patients things that they probably haven't thought of yet, like how's their family going to get dinner? Who's going to bring them to their appointments if their husband needs to keep working? Who's going to, help them keep their house in order so that they don't feel stressed there? I think that letting them know about the peer-to-peer support is obviously a huge factor. Women, I think especially, do better and do well when they have the ability to reach out to other women that are facing the same things that they are, when they're at the same part of life. I think that's how we cope. I think it's how we grow, and I think it's how we eventually move forward to what life has given us.
It's amazing how far we've come with the Pink Ribbon Girls. When we began, it was very humble, very grassroots.
When you have to spend time in a hot kitchen and you spend long hours and you do the work, it's all for a good cause. And I think that's really important.
And who knows what 5 years holds, but we do know that we have a highly motivated staff, and we're ready for all those new challenges.
It's become a project in our office that we all know about and talk about, and we feel We all feel this, maybe more than a lot of other projects that we've done. We're proud of the fact that we're helping so many women that desperately need these meals, and we're glad that we could offer a resource to make this program be successful and come alongside Pink Ribbon Girls.
You know, it hasn't been personal to me until this last year, to where it really got close to myself with my wife, Nicole.
So, 4 years ago when John decided to get the pink trucks as a corporation, I certainly didn't think that it would be something that I would use or it would affect my life. Early detection was key for me. I was diagnosed in February of 2016, and I'm able to say that now, today, I'm cancer-free. So if it wasn't for the Pink Ribbon Girls and the influence of that in my life, I can't say that that would be such a good story.
I consider a lot of PRG to be family now and very good friends. It really does support the fact that no one travels this road alone, and no one should travel this road alone. And PRG makes that happen.